Why some women don't experience orgasm. Who is at risk of sexual dysfunction? Both men and women are affected by sexual dysfunction. Sexual problems occur in adults of all ages. But it is usually more common in the elderly because their health decreases due to old age. What is the role of hormones in female sexual dysfunction? Hormones play an important role in regulating women's sexual function. With the decrease in female hormone estrogen due to aging and the onset of menopause, the vagina becomes dry and the sensitivity of the genitals decreases. Research showed that low levels of male hormone testosterone also play an important role in reducing sexual arousal, reducing reproductive sensitivity and orgasm. What is orgasmic disorder? In a simple definition, this disorder means that not reaching or very late to the peak of the orgasm despite the arousal is enough to determine the amount and type of stimulation to achieve orgasm in very different people. Orgasm in women is a refreshing mental and physical state obtained by sexual arousal. During orgasm, the pelvic muscles contract and slight tremors occur in the female body. When the nipple orgasms are provoked and tightened, the women's hole quickly opens and closes and their clitoris becomes large and bloody. In some women, the orgasmic phase ends with the eruption of ejaculation fluid from the vagina. After orgasm, the relaxation phase begins, during which the body loosens and returns to normal. The cause of orgasmic disorder in women. Women's sexual orgasm disorder can be caused by underlying medical conditions such as diabetes or hypertension. Anger, infection in the genital area or reaction, sensitivity to contraceptives can also cause this disorder. Medications prescribed to treat high blood pressure, digestive problems, anxiety and stress, as well as cancer, can cause this disorder. Types of orgasmic disorder. This disorder is divided into 4 categories. Primary aneurysm. Conditions in which a woman never has an orgasm. Secondary aneurysm. Difficulty reaching orgasm, in case the woman had easily reached orgasm in the past. Situational aneurysm. The most common type of dysfunction is situational aneurysm. This occurs when a person can only orgasm in certain situations, such as oral sex or masturbating. General aneurysm. Inability to achieve orgasm in any circumstances, even when the woman is very aroused. What causes sexual dysfunction? Physical factors. Many physical diseases can impair sexual function, such as diabetes, heart disease, neurological diseases, hormonal disorders, menopause and chronic diseases such as kidney disease or liver failure, as well as alcohol and drug abuse. In addition, side effects of certain medications, such as some antidepressants, can affect a person's sexual desire and function. Mentally factors. Anxiety and work stress, concerns about sexual function, problems with couples relationships, depression, feel guilty or the effects of sexual abuse in the past are psychological causes that affect a person's sexual function. How does sexual dysfunction affect women? Inhibited libido. In this case, there is no desire or interest in sex. Hormonal changes, diseases and their treatments, e.g. cancer and chemotherapy, depression, pregnancy, stress and fatigue are among the factors that contribute to lack of libido. Heartache and uniformity in sexual relationships as well as lifestyle factors such as job and child care can lead to lack of libido. Inability to be aroused. The inability to stimulate women is often because the vagina is not slippery enough to have sex. This disability can also be due to the woman's inadequate anxiety or stimulation for sex. In addition, researchers are investigating the impact of circulatory problems on the vagina and clitoris, whose findings can help fix arousal problems. Lack of orgasm, aneurysm. Women who have a lack of orgasm do not reach orgasm, and this can be due to sexual restraint, inexperience, lack of awareness and psychological factors such as guilt, anxiety or injury and sexual abuse in the past. Other factors such as inadequate stimulation, some drugs and chronic diseases also play a role in the absence of orgasms. Painful intercourse. Endometriosis, pelvic mass, ovarian cysts, vaginal inflammation, vaginal dryness, surgical scarring or sexually transmitted diseases are among the problems that cause pain during intercourse. Involuntary and painful contraction of the external muscles of the vagina is called vaginismus, genital intercourse pain disorder. It can occur due to fear of intercourse pain as well as sexual phobia or painful or bad experience in the past. How is female sexual dysfunction treated? Training. Teaching about the anatomy of the human body, sexual function and natural changes related to aging, as well as sexual behaviors and appropriate responses to them can help women overcome their anxiety about sexual function. Increased stimulation. The use of stimulating tools, movies or books, involves masturbating and changing repetitive methods of sex. Providing distraction techniques. Lustful or non-erotic fantasies, sexual exercises, can be used to increase a person's relaxation and reduce anxiety with music, movies or TV programs. Encouraging non-sexual activity. Non-doctrinal sex, sexual activity, which is physically aroused but not intercourse, such as physical massage, can be used to increase feelings of comfort and communication between spouses. Pain relief. The use of sexual intercourse methods that can control the depth of penis incarnation can reduce pain to some extent. Vaginal lubricants can alleviate pain caused by the penis hitting the vaginal wall. Hot showers before proximity help to increase relaxation. According to scientific studies, a healthy sex cycle has 4 steps, including 1. Sexual desire. 2. Creating sexual arousal. 3. Orgasm stage. 4. The final stage of subsidence. What is the effect of hysterectomy or asceticism on female sexual dysfunction? Many women feel changes in their sexual function after a hysterectomy or vector drainage, surgical removal of the uterus. Decreased libido and sensitivity of the genitals as well as vaginal dryness are among these changes. Problems like this can be associated with hormonal changes caused by the removal of the uterus. In addition, during surgery, blood vessels and nerves that play an important role in sexual function may be damaged. What role does menopause play in libido disorder? Reducing estrogen hormones with the onset of menopause can cause changes in women's sexual function. The emotional changes that menopause usually brings can increase the severity of women's reluctance to have sex or their inability to get aroused. Vaginal dryness and decreased sensitivity of the genitals can be important factors in women's sexual dysfunction by treating hormone replacement, HRT, or lubricants. If the problem is vaginal dryness, vaginal lasers can help to resolve the problem. If there is a problem with genital deformity or vaginal loosening, it is possible to correct vaginal deformities and relaxation with labiaplasty, perinorrhaphy or vaginoplasty. By strengthening J-point, the best and most effective result can be achieved in increasing libido and increasing orgasm. Vaginal irritation. Using the right oils to stimulate the vagina can increase blood flow in the genitals and is useful for treating this disorder. Estrogen therapy. Your doctor may recommend estrogen therapy. Estrogen can increase libido and increase women's sensitivity by increasing blood flow in the genitals. This can help with orgasms. However, the Food and Drug Administration warns about the side effects of using estrogen therapy to treat orgasmic disorder. Premature orgasm. One of the issues that is considered an enjoyable and effective satisfaction in a sexual relationship is the time to achieve orgasm, which should not be under 3 minutes. Early orgasms have reduced the quality of sexual relationships and also caused dissatisfaction for a close partner. Rapid orgasms should be treated and go to the best obstetrician for further examinations. Best time to achieve orgasm. Hours around the clock are better and more suitable for having sex. For example, when you get close to orgasm in the early hours of the morning, it is appropriate. Reaching orgasm in the morning hours is a successful day and is effective in releasing hormones to improve body efficiency. The amount and type of stimulation required for orgasm varies greatly in different women. Most women can reach orgasm after stimulating clitoris, equivalent to a man's penis in men, but less than half of women often orgasm during intercourse. 1 in 10 women never achieves orgasm, but many women consider their sexual activity satisfactory. Causes of orgasm in women. Vaginal dryness and hormonal disorders. Vaginal dryness is one of the causes that discourages women from having sex and thus fails to experience orgasm. Decreased levels of estrogen hormones in women cause this problem, making the relationship more painful and can sometimes cause bleeding from the vagina during sex. Vaginismus. Painful intercourse, known as vaginismus, is one of the most important causes of women's orgasm during sex. Vaginal dryness can lead to vaginismus if left untreated in the early stages. Fortunately, vaginismus treatment is possible by visiting a good gynecologist. Disapproval of the limbs. When a woman feels uncomfortable about the shape of her genitalia, her self-esteem decreases, which makes her unable to enjoy enough during the relationship. In these women, vaginal cosmetic surgeries such as labiaplasty, vaginal carboxytherapy and vaginal whitening can help to resolve the problem. Bad experiences from past relationships. People who have been subjected to sexual abuse or rape have difficulty in establishing sexual relationships, which is effective in their lack of enjoyment of the relationship. Pelvic cavity organ problems. Problems and disorders in the pelvic cavity cause pain in women during sex, and this negatively affects their orgasm. Aging. Aging and hormonal changes can also cause failure to reach orgasm. During menopause, due to hormonal changes, the problem of vaginal dryness increases, causing a woman's unwillingness to have a relationship or failure to gratification. Incorrect habits in life. In addition to physical and mental causes, incorrect habits in life such as alcohol and tobacco consumption and lack of mobility cause the problem of not satisfying women. The most important step for orgasm and treatment of orgasm problem in women is to increase the rate of two factors of tension and relaxation in a balanced manner during sexual intercourse. The type of tension that helps women reach orgasm is muscle tension. Muscle tension should be in the shins and generally the feet, pelvis and butt. Where is G-spot and what role does it play in orgasm? How to find G-point. The G-spot is a spot located in the ceiling of the vagina at 12 o'clock and at 2 centimeters inside the vagina, which is slightly more prominent than the rest of the vagina and can lead to orgasms when compressed into sex. At the point of G, the number of neurons is very high, and therefore it is very sensitive. Sometimes the G-point needs to be strengthened. Gel injection to G-point. By injecting fillers and gels into the G-point, as well as by the OSHAT or PRP method, the G-point can be strengthened and its sensitivity can be increased, so it is possible to stimulate an orgasm more in each position due to the prominence of the G-point. Golden tip. Treatment of orgasm with OSHAT therapy. OSHAT therapy is a procedure in which blood platelets are injected into damaged tissues of the body. This method can be considered as the most effective method in the treatment of orgasm. In the treatment of orgasm with OSHAT therapy, the patient's own blood is used for treatment. By blood transfusion, the contents of the blood platelets, which include glycoprotein, are injected into the side of the clitoris and the top of the vagina. This increases collagen formation in the vaginal area and increases irritability in addition to rejuvenation.